You're gonna see ads. You're gonna see prices that are all over the place. You're gonna see different marketing to try and get you to come into the office and to choose that doctor to do the work. You may be choosing the doctor you see. You may be choosing a clinic. You may be choosing someone that has no experience. Now, how do you as a patient choose the right doctor? I'm Dr. Jonathan Abenheim. I'm a double board certified dental implantologist. I've been in practice for about 20 years, and I'm gonna give you some secrets to be able to find out, is that doctor for you? So, what questions do you ask? Well, there's a lot of questions that you can come up with, but let's break it down to the nitty-gritty that will expose your dentist to see if they're really an expert at what they say they are. Number one, ask them to show you their before and after photos. Now, before and after photos can be very doctored. They can have some light, they can have different angles, but you want to see teeth and smiles in magnification. That means have them show you, just like my pictures, look here, up close and personal. Look at the detail of the teeth. Look at the translucency of the teeth. And more importantly, look if they're natural. Look if they look like they fit into the patient's mouth. Because most dentists will show you either a stolen photo, or even worse, a photo that's really far back and maybe photoshopped to make it look better. But have them show you not one, not two, not five, maybe 20 photos or 30 photos of cases that they've done over and over and over. And then you'll be able to see the real artistry that is possible for your smile. Because between you and me, what are you gonna do when you finish your teeth? You're not gonna look back and smile. You're gonna take that magnifying glass or that magnifying mirror and you're gonna look really, really close. Because you know what? When you get your dental implants, when you get your smile, when you get what you've been dreaming of your whole life, you want it to be there. You want to feel comfortable within your own smile. You don't want to hold back where you are probably today. So let's get you smiling and make sure you choose the doctor that has a lot of artistry. Number two, something that you need to realize is that when you're going to choose a chain implant clinic, that's a clinic that may have 5, 10, 20, 50, 100 practices all over the country. Well, they need to standardize the way they do things. And what happens then, think of like going to McDonald's. If you have a McDonald's burger in New York, or you have it in LA, or you have it in Tokyo, it will taste exactly the same. There is no individuality when it comes to that. When it comes to choosing a dentist, that's a big block chain. Every single patient is treated the same. There's no individuality. And what does that mean when it comes to dental implants? Ask them this question. How much of my bone are you going to cut away? Can you believe that? There are dental clinics that will go ahead and chop half your jaw away to fit in, not teeth, but what we call bolted in dentures. Now, you're probably in dentures now. You don't want bolted in dentures. You may have broken teeth, but you don't want dentures. Well, that's what they're doing for you. They're cutting away your bone, they're cutting away healthy bone, and they're bolting in really big prosthetics that they may show you looks really good when you smile, but let me tell you, they're not comfortable. And God forbid, something happens to your implants, you may not be able to do them again because they cut away support that God gave you, and they took it away to be able to fit into their mold of their process. Now, implant dentistry is not something that can't be custom. It must be custom because you, the patient, that are watching this, that need to have your dental implants done, need to be customized. That means the amount of implants is not the same for you than it is for the other one. The type of implants are different for you than it is for someone else. The size of the teeth, the shape of the teeth, the color of the teeth, the smoothness of the teeth, and I can go on and on and on and on. But more importantly, the way that you're gonna feel at the end of the day may not be the same for one person than it is for the other. You may wear the same Nike shoes, but they fit different on you. And that's why your smile and your implants and your veneers and anything you get in the cosmetic implant world of dentistry must be customized for you. So before you choose a big box or a 50 or 100 clinic office with a million moving parts, think twice. Choose a boutique office that has maybe one doctor that will be able to go ahead and know you by name, know your family history, know everything about you, know your fears, know your trauma, that will be able to help you and give you the dentistry that you deserve, and more importantly, the attention that you deserve. Number 3, how are your teeth made? How many people are getting it done? Do you have to go to one surgeon over there? Do you need to come back to have the restorative dentist? Do they need to have the lab technician waiting there? How many people are being involved in your dentistry? Ask that question. You know, in my practice, I'm your surgeon, I'm your restorative dentist, and I'm the artist that creates your teeth. Now, I have unbelievable assistants that help me to be able to make sure that you're comfortable, but when you get something complex as this, you want to make sure that there's one doctor that's treating you. Because if there's 50 different people, guess what happens to moving pieces? They move. And what happens when that doctor is not there anymore? Or that technician doesn't exist anymore? Or your file is lost? You know, digital dentistry allows us to keep our cases for years and years and years without any problem of storage. So the question you should ask this clinic or this dentist that you think you're going to choose is, how many people are going to be doing my work? How many moving pieces are there? What's the complication that's going to happen? That is extremely important. I would say choose an office where there's one doctor, one surgeon, one restorative dentist, all in one, that can specialize into that type of dentistry so that there's no questions at the end of the day, so that you get what you've always wanted. Because let's face it, it's a huge investment in not only time, but money also. And more importantly, you need to get over your fear that you're going to come here to have this work done. So make sure you choose wisely. Don't waste your time choosing, because your situation may get worse. But choose wisely so that you have the right place that will be there to be able to serve you for the years to come. Number 4, what happens after the treatment is done? Well, let me tell you something. As a practicing dentist for 18 years, these things need maintenance. Do they need a lot of maintenance? Do they need maintenance like natural teeth would? Absolutely not. They need traditional maintenance where you come in every 3 to 4 months and meet with the hygienist under the supervision of the dentist that did your work, to be able to make sure that everything is under control, whether it's your bite needs an adjustment, whether they're using specialized tools like we have in our office to be able to clean these restorations so that they don't scratch them, they don't cause bleeding where they don't need to be. They teach you how to clean these things so that they last. It's not about, you fly into, let's say, a country, or you fly into a city where you don't know where they are and you're gone. Make sure that you choose an office that has a maintenance program set up for you so that for a very, very long time you can have this taken care of. It's not about, well, I'll just go back to my dentist to have them cleaned. These restorations, whether it's these dental veneers, whether it's these dental implants, they need specialized care in terms of the maintenance so that they last an extremely long time. That is my advice to you. Choose an office that has a maintenance program after the fact. Number 5, and this will be the last one for this video, how long does it take? When you have these type of treatment done, this dental implant reconstruction done, you want to make sure that everything is done in-house. That means that the laboratory is done in-house. That means that their process is done in-house. You can ask them, how long is my surgery going to take? I can tell you that if they tell you it's going to take 8 to 10 hours, you should probably run, especially if it's 8 to 10 hours with sedation, because sedation under 8 to 10 hours is extremely dangerous, especially in a dental office. In our office, if we do the upper and the lower, it doesn't take more than 3 hours. And that's with your teeth, getting in, getting out, waking up, going to bed. That is the whole thing. Time is everything. So you may have to travel a little bit longer to see somebody like me, But let me tell you, the time is saved. You don't want to go to an office where you have to go 15, 20 times to have things that don't fit, that got lost, that need to be redone, and stuff like that. You want an office where it's done once and it's done well, without any shortcuts. So, the last and final question you should ask your dentist is, how long does the surgery take? If it takes more than 4 hours, find somebody else. How long is it going to take for me to get my teeth, and how many visits? If it takes more than 4 or 5 visits, you're probably in the wrong place. If you end up in my office, we'll be honored to treat you. If you're watching this from afar and you can't come to see us, make sure that you use these 5 tools to be able to choose the dentist and the implant office that will treat you like a human, that will treat you with respect, that will respect your time, and more importantly, that will give you the smile you've always dreamed of. Until then, I'm Dr. Jonathan Abenheim. Thanks for listening, and see you in our next video.